COVID cases are up again, so what is going on? Well, latest data from the Office for National Statistics show more than 1.4 million people in the UK are estimated to have had COVID in the week to the 9th of June. That's up 43% on the previous week. Let's put that in context. These are the weekly COVID numbers since the start of the year, with the big peaks of the original Omicron variant BA1 and its closely related sibling BA2. And the more recent rise, still modest, but likely to increase further. Why? Well, it comes down to a tug of war between the virus and our immunity. First, the virus, which has continued to evolve. There are two new members of the Omicron family called BA4 and BA5. They're even more infectious, leading to a recent rise in cases in South Africa, and they're now spreading in the UK. The Jubilee crowds might have fueled transmission, of course. Now, against all that, you have waning immunity. Statistics from the UK Health Security Agency show that immediately after the booster dose last winter, the vaccine was between 60 and 74% effective at preventing Omicron symptoms. But after 20 weeks, protection was, in its words, negligible. And having the virus doesn't do much to protect against reinfection either, according to recent research by Imperial College. So a combination of new, more infectious viruses and falling immunity points to a summer surge of COVID. Hospitalizations are already rising, though that's likely to be people testing positive after they've been admitted for other medical conditions. Even if the vaccine doesn't stop symptoms, it's still 77% effective at preventing serious disease, even several months after the booster. And there's been no rise so far in those needing a ventilator because of COVID. But with many businesses, not least airlines and the hospitality sector, struggling to find staff at the moment, the last thing they need is another surge in COVID, increasing the number of people off sick.